much. And I'm here on behalf of myself and my colleague, Seth Keller. We are the chairpeople of the National Task Force on Intellectual Disabilities and Dementia Practices in the United States. So Seth has graciously deferred to me to use my 13 minutes not to burden you with too many speakers. I'm going to be talking about a project that we've been running in the United States called the NTG for short. It's the National Task Group on Intellectual Disabilities and Dementia Practices. We organized this in late 2010 based on a voluntary participation model in which we asked for contributions of individuals from across the United States from different sectors, academia, family caregivers, public policy people, service providers, all the people you could think of to volunteer to become part of this national task force. The goal basically was to produce an action plan that would define what is needed in the United States to deal with the issues of dementia and people with intellectual disabilities as they grow older, and particularly those who are affected by dementia during that whole process. And in conjunction with that, we realized that there was no systematic or cross-cutting national plan that existed in the United States that dealt with the needs of people with intellectual disabilities. What I mean by that, if you're not familiar with the term, it's the old term was mental retardation, but this time we're using something that's much more contemporary, intellectual disabilities. And in terms of people who are affected by early or progressive dementia. And there were no documents that dealt with this issue at the state level either. The United States has 50 states, so there was nothing in those states. However, as we began this process, concurrently with it came a new federal law in the United States called the National Alzheimer's Project Act, which mandated the federal government to create a national action plan for dementia. And I'm sure you've heard about that from other sources, so I won't go too much into that. But it was timely because it gave us an opportunity to develop our plan in conjunction with what was being done at the federal level, so we could weave into what was done at the national level on generic dementia with the special needs of people who have intellectual disabilities. So we formed this group called we call it the NTG for short because the title is quite long. This slide would just tell you a little bit about what we tried to do in terms of when we framed ourselves. We had support from several national professional and advocacy organizations to create this task force. And again, as I said, it was based on voluntary effort. We did not have any financial underwriting except for some in-kind support services from the organizations. So the idea, again, was to produce a document which would help us define for the federal government and for organizations across the country what they would need to do to prepare for and to deliver services for people with intellectual disabilities. We wanted also to create some products, and one of the products was an early screening instrument which would enable people to better understand whether the person is showing signs of cognitive decline due to aging or cognitive decline due to dementia. And so, because if you may be familiar with this, if you're not, in general, the types of instruments that are used for screening and assessment in the general population do not apply very well to people with intellectual disabilities because of the floor effect. They tend not to have the same level of functional skills, and consequently, when you're looking for changes, you really have to go down below the kind of basic things that you're asking someone from the general population. So we began the task of trying to develop something like that. We also wanted to develop a set of practice guidelines that would enable people both in the medical and social care community to have a better sense of what they could do to deliver services. There are a number of other things which I'll discuss in a few minutes. The Napa, which is this National Alzheimer's Project Act in the United States, required the federal government and through an advisory council to produce a national plan. And that plan is in effect through the year 2025. So for the next 13 years, annually, that plan has to be revised, reviewed, and updated. And this is very good for us because we can work in concert with that particular effort to make sure that the interests and needs of people with intellectual disabilities are included. The United States plan, by the way, is one of 17 worldwide. The document that we produced, which is this document which is available on the internet, and the URL for it is shown at the bottom of the slide, we had a process which enabled us to develop 3 working groups, one on health practices, one on screening, and one on public policy. So the groups produced their documents. We had several plenary meetings that were underwritten to some degree by some of the supporting organizations at their annual meetings. They gave us a room to meet, so we had a chance to talk. We produced this document over the course of a year, so it came out in January. The timing was perfect because the federal document didn't come out until later in terms of May, so we're able to input into some of the federal conceptions in the federal document the issues of intellectual disability and Down syndrome, which are the two areas that are important. We also began to develop a series of public workshops that would enable providers and staff and family members to understand better some of the issues related to dementia. Now, this is an underlying document as well, as you probably recognize. This is the WHO document. And WHO document, I've just indicated on the slide here some of the mentions in that document to people with intellectual disabilities. So that we were very pleased to see that the international document did conceptualize this as an issue. And it did specifically mention our work in the United States. So I want to give kudos to those individuals who were following what we're doing and then included in that document. So that's the international document. This is the national document in the United States. It's called the National Plan to Address Alzheimer's Disease. And this document calls for a number of activities that have to be undertaken at the United States at the national level. One is the issuance of practice guidelines for the care and support of individuals with dementia and their family caregivers, and dealing with expanded public education. A promotion and assessment tool for detection of cognitive impairment as part of what is now required in the United States, having an annual wellness visit. So that's part of the new Health Care Act that we have. Enhanced supports for caregivers, expanded research, and then a special task group on people with specific needs, including people with intellectual disabilities and Down syndrome. Those are some of the things that are on that national plan. Our national task group basically, as I said, created a national plan. And this document not only conceptualizes and talks about some of the issues that are faced by people, caregivers, providers, families, people who are affected in terms of dementia, but it also kind of points in direction in terms of what could be done to both deliver services, develop services, and to attend to planning for services. It also identifies a workable administrative screening instrument. We're in the final stages of issuing that instrument. We've done some field tests on it. We're probably by Christmas time we'll be able to get it out into the public domain. Our hope is that it will be adopted nationally by organizations that serve people with intellectual disabilities, so they can use it when they suspect that a person is declining because of potentially having dementia. And this will enable them to have some information which they can then take to a physician or assessor to have begin the dialogue, begin the conversation around what assessment needs to be done to formally justify a diagnosis or a suspicion of diagnosis in terms of dementia. So it's a first instance screen. It isn't done for a clinical assessment. And also we're in the process of producing several practice guidelines on health screening and also for medical and allied health care. So those will be coming out in journals and in official publications and posted on our internet site, which is listed on the bottom of that slide. Any of these documents I'm referring to, any of these work that we're referring to, can be accessed at that URL, the internet site that's listed there. And then also we're looking at a number of other areas in terms of training and advocacy with parent groups. So there's a number of things that are going on. We're in the process now in our second year. We're moving ahead to the third year of our existence, and we're going to be following very closely what's happening at the national level with the National Alzheimer's Plan and working in concert with us. This just kind of illustrates some of the activities that we have undertaken and plan still to undertake in the next number of years. There is a new federal agency in the United States at the national level called the Administration on Community Living, which is an amalgam of the Administration on Aging and the Administration on Intellectual and Developmental Disabilities, so it's been subsumed. So we're working closely with that federal agency to begin to see how services and other issues can be brought to bear in terms of how that federal agency distributes information and funds and other technical information down to the state level. So these are very good areas that we've been working on. And also the training and education activities. We have a series of webinars, which are internet-based, that are available to people to access. We have localized training. We're doing a training in Los Angeles next week, a day-long workshop. We've got another couple scheduled this year, and we're building a schedule for a number next year. So those are coming in the works. So the lessons learned from this whole process, just to share them with you. Basically, remember, this is a voluntary effort. There was no critical financial underwriting for this. We did it on a shoestring. We got some small change from the organizations that supported us by giving us meeting space and supporting us with internet technical support, things like that. So the people that were involved in this were basically volunteers. We ended up with over 100, close to 120 people who make up the National Task Group. Now you can say that's a lot of people to meet. They all don't meet. They basically are on this internet-based task force. We have a core of about 25 to 30 people who do most of the work. We have a telephone conference call every 2 weeks where we confer with each other to see what people are doing. We have working groups that are working on documents, so we have workers. And we have this extended group that's a part of the task force to kind of feed back information to us in terms of how we're doing and give us recommendations and review some of the work. So we have a mix of expertise. We have academics, policy people, administrators, clinicians, families, people with intellectual disabilities, and these are all folks contributing to this effort. Now, the plan is in place. Now we're trying to monitor the actions that have to be undertaken to carry out the things. So we're also looking at the other issue, the learning lesson basically, is that the integration with the mainstream Alzheimer's efforts can be very effective. But I think, and having discussions with this in other countries with people, I'd recommend strongly that the course of action be focused on intellectual disabilities or any kind of specific population you're dealing with first. Develop your document and then blend that into the national Alzheimer's development work. Otherwise, you'll be lost in the noise, as it were. So those are our recommendations from the lessons learned. This is our group. Our supporting organizations are listed on this slide, and myself and Seth Keller are the co-chairs. So if you have any information, you want to get any more information, you can contact us. Our emails are up there. Our URL is there for the website of the project, and we certainly will be reporting an interim basis in terms of where we're going with this. So we have another 13 years under the federal law in the United States to kind of continue this and see who lives first, who's still around in 13 years, but we'll try to do our best. Thank you very much.
Thank you very much, Matthew, to share your American experience with us. Maybe stay, you were wonderful in time, so we have time maybe for 1 or 2 questions. Are there any questions? Yes, please. There's a mic somewhere. The mic is coming.
I can repeat the question. Oh, yes, of course.
Maybe can you repeat first the question because of the translators?
Question is, the title of our report is called My Thinker's Not Working, and the long title, and now you realize why we're calling it the Thinker document, that a national strategy for enabling adults with intellectual disabilities affected by dementia to remain in their community and receive quality supports. That's a mouthful. So our short-term title is the Thinker document. And the reason we call it the Thinker's Not Working is that we had an interaction with a gentleman in the Midwest in the United States who talked to us about his being affected by dementia. And the way he interpreted it is that his thinker wasn't working. And so we thought that's a great way to kind of to conceptualize what's going on, and we've got some very good responses from that. So that's the reason that it's called My Thinker's Not Working.
Thank you again. Thank you, Matthew.